Greetings to everyone, especially to our beloved and respectful lecturer, Madam Tatiana. So before we start, let me introduce to you our team members. Okay, so before we start, let me briefly explain the objective of our presentation. So by the end of the session, you will gain an understanding of calcium phosphate as an ionic crystalline solid found in bones and teeth, and you will also understand the crystal structure of hydroxyapatite and how this structure gives strength and rigidity to bones and teeth. And next, we will relate bone strength to the arrangement and stability of crystalline solid, and finally, we will apply this concept to a medical case study of osteoporosis, showing how crystallization and dissolution of calcium phosphate affect our bone health.
Calcium phosphate. Now, let's look at the material itself. Calcium phosphate isn't just one substance. It's actually a diverse family of compounds. These are characterized by calcium ion paired with functional groups like orthophosphate, metaphosphate, or pyrophosphate. In some variations, you will also find hydrogen or hydroxide ions integrated into the structure. This chemical versatility is exactly why they are so prevalent in nature, most notably as the primary inorganic component in our own hard tissues like bones and teeth. When we examine this compound at the atomic level, we look at their crystalline arrangement. A crystalline solid is defined by groups of atoms positioned precisely at the sides of a Bravais lattice. If the entire atomic structure is uniform in both its orientation and its composition, we classify it as a single crystal. However, in most practical application and natural occurrence, the structure is not perfectly uniform. In these cases, it is known as a polycrystal. Understanding whether a calcium phosphate sample is a single crystal or polycrystalline is crucial, as this structural difference directly impacts the material's strength and how it behaves within a biological system.
Next, we will explore why calcium phosphate is a crystalline solid and examine its structure in bones and teeth. Calcium phosphate has the formula CH3PO42 or hydroxyapatite C18PO46OH2 in biological systems. It's the main mineral in our bones and teeth. Calcium phosphate is crystalline for three reasons. First, it has an ionic nature composed of cations and phosphate anions held by strong electrostatic forces. Second, it has a regular arrangement with ions organized in an ordered, repeating 3D lattice. Third, it has different geometry, forming hexagonal crystal systems. Calcium phosphate is classified as an ionic crystalline solid. It exhibits typical ionic solid properties, high melting point of 1670 degrees Celsius due to strong electrostatic forces, hard but brittle structure, and act as an electrical insulator because ions are fixed in positions with no free electrons. These are the same characteristics seen in other ionic solids like sodium chloride and potassium chloride. Now, let's look at bones and teeth structure. Bones contain 70% inorganic hydroxyapatite crystals, 20% organic collagen fibers, and 10% water. The crystals are nano-sized at 50 by 25 nanometers embedded in the collagen matrix. This provides strength, rigidity, and serve as mineral reservoir for calcium and phosphate ions. Teeth have three layers with different hydroxyapatite content. The enamel outer layer is 96% hydroxyapatite, the hardest substance in the human body with highly crystalline structure. The dentin, the middle layer is 70% hydroxyapatite plus 20% organic material, similar to bone composition. The cementum, covering the root, is 65% hydroxyapatite and anchor the tooth to the jawbone. The crystals are organized into rod-like animal prisms for maximum strength. Why does crystalline structure matter? It provides mechanical strength through ordered lattice arrangement, serves as mineral reservoir with controlled ion release, ensures durability through strong ionic bonds, and enables bioactivity for bone remodeling. In conclusions, calcium phosphate is crystalline due to its ionic nature, regular arrangement, and different geometry. As an ionic crystalline solid with strong electrostatic bonding, it provides the essential properties needed for bones and teeth, which are strength, durability, and mineral storage.
This slide shows a medical case study related to osteoporosis. The patient is a 65 years old postmenopausal woman. After menopause, estrogen level decrease, and this hormone normally helps maintain bone minerals. When estrogen is low, bone mineral loss happens faster. She experienced lower back pain and has a history of minor falls that cause fractures. This shows that her bones are weak and easily broken. She also has reduced dairy intake and limited sun exposure. Dairy products are a main source of calcium, and sunlight is needed to produce vitamin D. Vitamin D helps the body absorb calcium. The DEXA scan shows a T-score of -2.8, which confirms osteoporosis. This means her bone mineral density is much lower than normal. Blood tests show slightly low calcium, normal phosphate, and reduced vitamin D. From a chemistry point of view, this means there are not enough calcium ions to maintain the solid crystal structure in bone. Therefore, the diagnosis is excessive bone demineralization, which means the crystalline calcium phosphate in bone is being lost.
By the medical case study on our previous slide, maybe you have some question on what are the chemical and reaction process that involve in osteoporosis. So here we go. So firstly, let's focus on the nature of bone mineral as a crystalline solid. So the main inorganic component of bone is hydroxyapatite with the chemical formula of calcium 10, phosphate 6, and hydroxide 2. So this compound is classified as an ionic crystalline solid because it is compound of oppositely charged ion held together by electrostatic forces. So calcium ion act as cations, while phosphate and hydroxide act as anions. So these ions arrange themselves in highly ordered and repeating crystal lattice. So this long-range order is what gives bone its rigidity and mechanical strength. Then the stability of this crystalline structure depends on factors such as pH, ion concentration, and hormonal regulation. For example, acidic condition increase the solubility and promote the crystal dissolution. And when the hydroxyapatite lattice is stable, bone formation dominates. However, when the lattice becomes unstable, the crystalline solid begins to dissolve, leading to a reduction in bone density and strength. So next, we will explain the chemical reaction involved in the formation and breakdown of bone mineral. So under the normal physiological condition, calcium ions, phosphate ions, and hydroxide ions will combine to form solid hydroxyapatite, and this reaction represents crystallization where free ion in solution assemble into a stable crystalline lattice. So this process increases bone hardness and structural integrity. However, in osteoporosis, the reverse reaction becomes dominant. The solid hydroxyapatite undergoes dissolution, breaking apart into calcium, phosphate, and hydroxide ion, and acidic condition and hormonal imbalance shift the equilibrium toward dissolution and disrupting the crystal lattice, and as a result, the bone loses rigidity and becomes porous. And from an inorganic chemistry perspective, osteoporosis is essentially a shift in equilibrium from crystal formation to crystal dissolution, leading to the loss of a structurally important crystalline solid in bones.
Medical care related to calcium phosphate focuses on controlling how calcium phosphate forms in different parts of the body. In teeth, medical care helps strengthen enamel and makes it more resistant to acid. This is commonly done using fluoride, such as a fluoride toothpaste, which helps protect calcium phosphate in tooth enamel. In bones, medical care supports the formation of calcium phosphate to keep the bone strong. Calcium, phosphate, and vitamin D are important for this process. In disease like osteoporosis, treatments such as biphosphonates are used to slow down the bone mineral loss. In soft tissues, especially blood vessel, calcium phosphate should not form. Medical care helps prevent this by controlling the balance of calcium and phosphate in the body. For example, in patients with chronic kidney disease, phosphate levels are managed to reduce the risk of mineral buildup in blood vessel. Overall, medical care ensures that calcium phosphate forms in the right places, such as bones and teeth, while preventing harmful buildup in soft tissues. In conclusion, calcium phosphate is a crystalline solid with an ordered ionic structure. In the body, it mainly exists as hydroxyapatite, whose crystal structure is essential for the strength of bones and teeth. This shows that bone and tooth strength depend on the arrangement and stability of calcium phosphate crystal. Therefore, understanding crystalline solids help explain bone health and the role of medical care in maintaining proper calcium phosphate balance.